I'd like to thank you guys for coming here and watching my presentation. It means a lot. And just to let you know, before the presentation starts, you could leave all your questions till the end because I'll have questions at the end. So, you guys are probably wondering why you're here, why you're learning about anatomical terminology, why is it important to you guys? You already know the common names, you can talk about your body, you don't need to know the anatomical terminology. However, why it is important is because if you're reading any biological or medical text when you guys go to university, you never know what's going to take you there, where you're going to go. So when you're reading that text, it might be nice to actually know what they're talking about when they say sura or something like that. It's important because when working out, maybe you look up a workout online, you see, hey, they're talking about a stretch, and you're wondering what it could possibly mean. You don't know when they say you need to stretch your antebrachium. What could that possibly mean? Stuff like that. And then maybe even a little lesser point, but still, go to the doctor's office. He says you broke your carpal. Maybe you don't have to get him to explain because you actually know what it means. And yeah, that going. Okay, that's my joke. That's a joke spot. Alright.
It was good.
Anyways, so it's important while reading medical text and anatomical terminology, and I think to help you guys learn, to get one of you to come up here and I'll point out where everything is.
Right now?
One of you guys, I don't care.
I'll go up.
Okay, you. So some of these names are obviously going to be more common than others, like something that you might know. Like if I said gluteus, you guys would know that. Yeah, that's the butt. Yeah, okay. And then maybe you might even know this one if I said cranial, which is
the dome.
Yeah, I'm going to be touching you inappropriately, by the way.
That's fine.
The dome, yeah. Which, but the actual common name for cranial would be, I think you know?
Head? Brain?
Cranium. So close.
Okay.
The head is actually the cephalon, which is that area.
Cephalon.
Cephalon, sorry.
Cephalon.
Yeah. And then we have the optic and the orbit, which is the eye and the ear. We have the nasal, which I'm sure you guys could guess is the
nose.
Yeah.
Nose.
And then oral, which is
the mouth.
Yeah. Alright.
Yeah.
And when we go down to that area, it is cervical, which is the neck, obviously. And I think you guess what this is. Pretty
shoulder.
Yeah, it's actually shoulder.
Really?
Yeah.
There's no actual technical word for it?
Yeah, it's just shoulder.
But
you can go into it and be like, the point of the shoulder is called the acromion. So there's different areas of the shoulder that you can go in. And then if we go down, we have the the brachium, which is that area, the front, and then the antebrachium, which is his forearm. And we have the cubital, which is his elbow, and then the carpal, which is the wrist. Could you guys guess what the fingers are called? It's kind of common knowledge.
Well, now I'm embarrassed that I don't know.
Yeah, I know. The phalanges.
The phalanges. Common knowledge.
Okay. Anyways, so if we go back to the trunk, which is basically like your whole midsection.
The trunk?
Yeah, the trunk.
I like it.
Yeah, it's this part is called the thoracic, and you can go into it and you have the pectoral muscles, which I'm sure you guys know. Yeah, there you go. And then can you guess what the
abdominal?
That is correct.
Abdomen.
Yeah, and if we turn you around once again, we have his back muscles, which are the lumbar, and then the lumbar vertebrae there too, which are the bones.
What are lats?
Lats.
Oh wait, sorry, I'll save my question.
Okay. Okay. And turn around. And yeah, okay. And then for the thighs, what would those? Do you guys know what those would be called?
Quadriceps. No.
The region is related to the bone. If you know what the bone is, there it's called.
The femur.
Yep, it's the femur.
Oh, okay. The femoral region.
Yeah, and then.
That actually is.
Yeah, it's femur for the thigh.
Oh yeah.
Yeah. And then the knee is the patella, and then the back is the calf is the sternum, and then we have the foot, which is the pedal, and then the sole of the foot is the plantar.
The foot called the pedal?
Yeah.
Man, everything's starting to make sense now.
Yeah, everything's
pieces are connecting.
You can sit down if you want for this next one.
Okay, thank you so much.
No problem. Thank you, sir, for your participation.
Thank you. Awesome.
Oh, boy.
Oh, spoiler. Worst presentation ever.
Alright, so now that we know some of the anatomical terms, we can also figure out the direction used. Like we say for a map, we say north, east, south, west. For your body, we have different terms that we use. So some of the first
good idea.
Yeah, so you could say something like your patella is superior to your plantar. And then we have the distal and proximal. And proximal means it's attached to the base, so you'd have like your shoulders proximal. And then distal is far away from the attached base. And then we have medial and lateral, which you guys could guess maybe what medial is.
Very simple.
The middle,
I'm here to learn.
towards the midline or the middle, and then lateral is going away from the midline. Then we have coxal, which is towards the tail or towards the coccyx in humans, and then we have cephalic, which means towards the head. And yeah, so those are. Well, there's a lot of other ones, but you know,
There's a lot of directional terms. Wow.
Yeah, there's also.
I didn't know.
There's also deep and superficial, which I feel.
Even more.
Could you guys guess what deep and super? It's basically what they say.
Like from your skin, deep is.
Yeah, like deep is deep inside.
My bone's deep and my skin is
super.
The other word?
Well, it'd be like superficial. It's like your bone's deep and then your muscle is superficial because it's closer to the surface and deep is.
Oh, that makes
inside the
perfect
surface.
sense.
Yeah. All right.
Another piece all going together.
So another little joke slide.
Well, yeah. Oh.
Alright.
Oh, that was fantastic.
That was great. I'm glad to hear that. Alright, so
man,
Josh, you want to be the guinea pig this time? Alright.
You're the
You don't have to do that. So, with all we know now directions, now we know the anatomical terms, but everything happens in different planes in your body, and everything has an axis of motion as well. So, there's only 4 planes, so it's a lot simpler than other ones where there's a lot more terms to understand and know.
Okay.
Yeah. So, for the first plane, we have the sagittal plane, which cuts the body in half. So, it's the plane from there to there, it's the left and right side, and it's in the frontal axis. And it's basically, yeah.
Is that torso? Just the torso?
No, it's all the way down.
Okay,
the
cool.
whole body in half. And it's basically any movement in that vertical plane. So could you maybe demonstrate a workout that you think would be in that plane?
Is it like I'm going parallel to the plane? Would be a
No. It's like
perpendicular?
Yes.
This.
Or sorry, not parallel. Sorry.
Oh, you jerk. Benches.
No, because
No.
it's any movement that goes from like.
Oh.
So
if I did this.
yes, or like a
Yeah.
curl or something is in that plane. And a lot of
I'm learning.
Yeah, and the terms that we use for that are common terms that you can use is flexion and extension. So when you do the bicep curl
For the front plane?
for the sagittal plane in the frontal axis.
Sagittal plane, frontal axis
Yeah.
is flexing and extending?
Yes, because this is a flexion. It's whenever you bring another bone to another bone. Yeah. And then extension is completely leveling it out. And then the next plane is pretty easy to remember too because it's the frontal plane in the sagittal axis, and it cuts you like in 2 pieces from like this way. So for the anterior and posterior, you'd be cut that way from the anterior and posterior. And do you think you could think of a workout that'd be done? Yes.
Yeah.
Shoulder raises, yeah.
That's a good one.
Yeah. And then you have the common terms that are used in that one are abduction and adduction. And abduction is when you go up, and then adduction when you come down. So it's basically the lateral movement in that way. Woo. And then the next plane we have is the transverse plane, which cuts you in half this way. So you have the upper part and the lower part, and it happens in the vertical plane, or axis. And I think you could think of a workout that may be done, or like any type of movement.
Yeah.
No.
With like,
yeah.
with like sit-ups or V-ups do that?
No, it's basically any twisting.
Oh.
So like that, like say you're like stretching like that, any twisting that's done in that region. And then the final axis and point of motion is diagonal, and it's the diagonal plane and diagonal axis. And yeah, it's literally like any movement that you do. Yeah, basically any of the 2 points of motion combined or more. So basically, it's like motion movement. Like say you're playing tennis, that'd be a diagonal, and you're using all those different muscles and the directions to use them.
Hmm.
Yeah. You can still stay up there system as well too. In third room.
Wait, you get to go twice?
Yeah, sorry man. Alright, so now that we know all those, you can combine them into like one terminology basically. So when we're talking, Dawson can demonstrate a sit-up.
You chose the wrong
Oh boy! Yeah, I know. So, instead of it just being a sit-up anymore, if he does the sit-up, you can, now it's a vertical flexion in the sagittal plane and the transverse axis of the lumbar.
Do I have to do more?
Yeah, you can just do one, it's fine. Or you can say things like when you're playing tennis, like I said before, you can say that it's using things like your antebrachium, your brachium, your shoulder, and it's in the sagittal plane. And yeah, it helps with like just talking medical professions. You know exactly what you're gonna have to say to these people. You know exactly how they talk. Or bicep curl could become a flexion in your antebrachium and your carpal or in your cubital. No, flexion in your cubital, working the antebrachium part of your muscle, and then being the sagittal plane and the transverse axis. Yeah.
Wow.
You can sound real smart.
That's a lot of terminology.
Yeah, man.
I never knew I was so ignorant.
Yeah. And in conclusion, we have that all the anatomical terms you could use to talk to people. We have the directions they use, like proximal and distal. We say that they can all be used in different points of motion. They all happen in different points of motion. And together, they form a new way of speaking that you can talk. You can say new and wonderful things to people. And yeah, if there are any questions.
What plane is benches in?
What plane?
Yeah. Describe, I want to know everything about benches.
About the bench press.
About bench press.
Okay, well that would
bench press.
That would be in the
plane it's in.
sagittal plane.
What muscle it's working.
Front. Sagittal plane.
My question.
The frontal axis, and you work in the pectoral muscle along with your bicep and tricep. And yeah, I think a little bit.
Yeah.
For V-tips and like sit-ups, what plane would that be in?
Z-sits would probably be in. That'd be in the diagonal, yeah, that'd be diagonal for both of them, and then sit-ups would be in the sagittal plane because you're only using the vertical. So that, like basically anything that where you're flexing or using flexion is when you have sagittal plane.
And it's flexion and what? What's the other word?
Flexion extension. So this is flexion.
Yeah.
That's extension.
Okay, so when you sit up, you're flexing your abs to go up and
Yeah.
go down. Okay.
Yeah. So, and with that, if there's no other questions.
That's everything I wanted to know.
Yeah, I think
Okay.
I feel pretty educated now.
Alright, well, great. Thanks guys for having it, for coming and listening to me.
Thank you for the free lesson.
Yeah.